Hey students in PhD 342, we're going to start into mindfulness and what that is. So strap in, here's our lecture that we've got, part of one of two that are going into mindfulness-based stress reduction. So first thing that we've got is understanding what's happening with the body and the stress. So we all for sure experience routine stress. Those are just the things that come every single day with life. So it's the annoying sound of the alarm clock or on your phone, it's traffic, it's the things that you just have to do, the things that are kind of are repetitive, but the level of impact on our life is, it's almost more of like the nuisance kind of thing, or it could be some of the daily stresses that come perhaps from relationships, having homework, stuff that you have to study, those kinds of things. So this is what we got. Typical things that you're seeing here. Money, also a big stressor. Finances is in that list. Then we've got acute stress. And so this is related to something that is sudden, and then it's negative, and it's not a routine thing. We definitely don't want acute stressors to be a routine thing, unfortunately, too. So this could relate to a sudden onset of an illness, a loved one passing away, losing a job, changes that might come from those types of things. And then we have a third general type of stress that's called traumatic stress. And so this is when you are in danger of being hurt, physical, emotional, mental harm to yourself in a situation, or even being killed. So very, very highest level. So this is a major accident, a war, some sort of assault, a disaster, those types of things. So what happens now, knowing we have these three different types of stress, we have to look into what the basic stress response is from the body. So we know that our hypothalamus, it triggers our adrenals to release cortisol and adrenaline. And so we know adrenaline, what happens with that? Heart rate shoots up, your blood pressure shoots up, you have more energy. It's kind of this immediate sense of like, okay, I have to work, I have to do something. And then we also have an increase in cortisol. So in cortisol, or when cortisol increases, it helps our brain's ability to use glucose essentially for energy and for function. And then cortisol can increase the availability of reparative substances for the brain. So things we have to keep in mind though with cortisol, it curbs the effect of non-essential functions when we're in especially a fight or flight, or in that really high level adrenaline type of response. So we know that when our cortisol increases, we tend to see alterations and even potential diminishing of our immune system. Digestion slows down, reproductive health, growth and development slows. And cortisol has huge impacts on our mood, our motivation, our fear, other types of things that are important for just our general functioning and more of our emotional health. So now, knowing what we know, we have some different types of stress. We have what happens when the body is under stress. So problems that we have, especially in our society, and if we think of COVID-19 especially, typically, once a threat of something acute or unfortunately, hopefully not traumatic, but it happens, once that threat is no longer perceived, ideally the body should be returning back to normal. But when we have this long-term activation, so chronic stressors that our body, or we're treating like acute stressors over and over again, or multiples in a period of time, or when we have traumatic stressors where we're unable to get support to process those, we have this long-term activation of the stress response system. Not good. So then we have an overexposure to cortisol and some of our other stress hormones. And you can see from the list here of all of the kind of side effects that happen to us when we have heightened and prolonged overexposure to cortisol and our other stress hormones. If we look at that list, it's a lot of the issues that a lot of people face on a really, really regular basis. And we look at a lot of these issues and they're impacting quality of life. They're impacting our general overall health, our general sense of wellness. And even though we're not talking about athletes in this type of lecture, if we are talking about a performance situation where we might have an athlete needing to perform at a high level of pressure in a game or contest, when we have anxiety, depression, sleep problems, memory impairment, concentration, lack of focus, even weight gain, that can be problematic. So, but I like to think of when we see the general society These are really problematic things that are extremely prevalent. And so we know when we have high levels of stress, it's going to impact those indicators, and those indicators impact quality of life. So what determines how we as people process our stress? If we're able to release chronic stress or have ways to release acute stress, how do we know who gets stuck with what? So genetics are one big factor. We know that there's genetic variations that can lead to either an over or an underactive stress response. So we always know genetics are in there somewhere. Life experiences. So if you have had maybe a few more of those acute experiences and you're able to process those, the little things might not seem as big of a deal. It's kind of the classic example of like, you know what, if you've handled some stuff, you're able to handle some other stuff. So traumatic events, those can have an impact. If we've had any sort of formal training. So if you've been in a situation where you've had trauma-informed education, maybe you've had formal mindfulness or meditation training, maybe at a professional level, any sort of de-escalation training, something that we often see maybe sometimes in medicine, sometimes in law enforcement, any sort of training that helps you process and manage emotions, process and manage stress, that can have an experience on how you process it. Modeling by others, this one is key. So if we talk about genetics, okay, if my parents, family line, lineage has had this genetic variation, but then if you witness someone significant in your life always having a very high reaction and overactive stress response, think of it as a kid, you're going to see that as a normal response. Or if you're seeing a very underactive, blunted stress response, almost where they disassociate from the stress, you're going to see that as normal too. So we have to keep in mind that the modeling by others is really, really significant. And then mind-body stress reduction practices. So that could come in the form of things that come through training. So let's say you use an app that helps you meditate. That's a mind-body stress reduction practice. Maybe you like to keep a routine. Every morning when you wake up, you have this routine. It helps you get your day going, or maybe at the end of the day, you have a closeout routine, helps you just let go of things that happen in the day and prepare for rest. Those are examples of practices that help with the mind-body stress cycle and processing through that cycle so that we're reducing those levels of chronic stress. So we are going to be looking at mind-body stress reduction or mind-body therapy in terms of how it impacts health. And so we know that there are positive benefits in all of the areas that are listed. And in the readings that you have to look at, you're going to see some examples of studies where mind-body therapies or stress reduction techniques have helped everything on this list. And so when the list is pretty comprehensive, and again, if we think of major issues that plague kind of the average person throughout society, heart disease, that's one of our #1 killers, headaches and insomnia, major issues that just help our ability just feel like ourselves and recover, incontinence, lower back pain, very annoying and nagging things that will impact our quality of life. Not necessarily cancer itself, so it's not a cure for cancer, but symptoms that come from cancer and even the cancer treatments that people are going through. The mind-body stress reduction therapies can be a support in that process of treatment. And then there's also tends to be, we've seen in studies, improvement in post-surgical outcomes from patients who use mind-body therapy. So that means after surgery, patients are put on some sort of recovery type of plan. They have outcomes and goals, maybe milestones that they need to hit before they're able to receive another level of treatment or switch to another kind of facility, or go a certain amount of time without medication or without doctor check-ins. And so that's a really key indicator for returning back to normal, back to whatever normal is for someone who has a surgery. And then hypertension, arthritis, also major things that we definitely see in our population. So what is mind-body therapy? This is what the National Institute of Health says. So it's a type of intervention that uses a variety of techniques. So that's something we have to keep in mind. It's an intervention, lots of different ways to do it. And it helps facilitate or grow or improve the mind's capacity to impact bodily function and symptoms. So basically, teaching and finding ways to use our mind to help our bodily function and help symptoms feel reduced. So Typical things we might see: relaxation therapy, meditation, mental imagery, hypnosis, biofeedback are all common. So going into a few details about what each one is. Relaxation, one of our favorite things. Our goal is just having this psychophysiological state of where our body feels relaxed. So the mind is relaxed. And then physiologically, we're seeing these indicators of just lowering heart rate. So we see this reduced sympathetic arousal, a little bit of a lower metabolic state, very calm. Think of, when we're preparing ourselves for sleep or rest or recovery, we want to engage the parasympathetic nervous system, let go of that sympathetic arousal. Muscle tension is softer, it's reduced. That's kind of our goal. Meditation. So this is intentional self-regulation of what you're putting your attention to. And so it's usually, often we see it developed in a spiritual context, but does not have to be. And the idea often in these spiritual contexts is that we want to attain some sort of growth or personal development, personal transformation through it. And we see with transcendental meditation, this is the concept of where you're focused on a mantra, a phrase, a picture, a statement, a feeling that you want to have. And the goal of having intentional focus on this phrase or on this thing is that you're going to quiet everything else in the mental stream so that you can bring your focus into this chosen and intentional concept. And then we have mindfulness meditation, a little bit different. So this is where we're not choosing one particular thing to put our focus on. We're just letting ourselves be. It's the simple act of just being, but then we observe our thoughts. We note them, we note our emotions, sensations, anything that we perceive in that process in the very, very present moment without attaching value or judgment or assessing them. It's merely just saying, yep, I think this, and we let it go on. And so we're still trying to quiet that mental stream, but as things pop into the mental stream, we're working to just notice them, and then let them pass on. So you're going to see in all of the meditation and mindful practices that we're going to be doing in our class, the cueing, no matter where the format is, if it's something I'm doing a recording for you, or if it's something we're hearing through a website, through app, through YouTube, that's going to be a pretty common type of outcome in mindfulness. Guided imagery uses this idea of creating images in our head, and it's something that you can do alone or with a facilitator. Often when you're new to guided imagery, it's something we do with a facilitator. And you want to evoke a sense of affect. So that means a feeling that we attach to these images in a really relaxed state. So if you think of something that always helps me, is I think of a beautiful sunny day, laying out in a big field, just grass, smells like air, everything is green, it's so peaceful, so beautiful, but still alive at the same time. That's always my go-to for feeling good. And so I'll think about all the little details that exist in this picture that I make in my head. And the affect that it creates within is this sense of contentment, of gratitude, of freedom, big open space. And that brings me to a really calm state of relaxation. And so whether you're facilitating it for someone else, or you're facilitating for you, or a facilitator is doing it for you, it's incredibly descriptive. So if I'm talking about this big open grassy field, I'm talking about what the grass smells like. I'm talking about what the blades of grass look like. I'm talking about the sounds that we hear out in this field, anything that's up overhead. We talk about temperature. So really, it's as if you're trying to painting this picture with words of what it looks like, so that the person almost as if feels like they're there. Like they might even feel sometimes within mental imagery, like if we're talking about the sun on their face and this warm field on a beautiful sunny day, they might even actually feel warmth. Their brain might even create that sensation. So we have this outcome in mind, so it's to be relaxed or to be energized or to relive a certain experience. So this is where we see in mind-body therapy and in some of the studies where for a cancer patient, that they create this image and this process, almost like an internal narrative of their immune system, say when they're undergoing treatment, attacking and being victorious over the cancer cells that are in their body. or envisioning oneself kind of like the perfect day scenario. What does healthy look like to you? And what does happy look like? And so if I were working with a client or an athlete on this, I would have them describe like what's been a really happy situation, or what is their goal in their mind. If they had to picture themselves happy or so healthy, what would it feel like, look like, be like? And then we create this picture and we take them into this meditative type of guide. For athletes or any type of performer, we also can envision an ideal performance. So this could be something that has happened in the past or maybe has not happened. It's a future performance that we're ready and gearing up for. There's a couple other mind-body therapy methods that are used that are not commonly used in the sport performance or the fitness field. They're more in the clinical type of state. So we have hypnosis, which is very specific. So this is where you're really suspending your peripheral awareness, just letting almost think of it as the opposite of mindfulness. Mindfulness, you're pulling in all these, noting everything of what's going on in your peripheral awareness. Hypnosis, you suspend all of that. And so you're put into this very natural state of being attentive and being focused in your concentration without the peripheral. So this brings in concepts of disassociation, being able to suggest things to the client or to the patient and have them absorb information. And then another mind-body therapy method that we see in the research is called biofeedback. And so this is where we're taken through relaxation, imagery, mindful types of processes, but then we're being tracked when it comes to blood pressure, our temperature, heart rate, and what is being given to us in terms of the therapy is based off of that concurrently measured biofeedback at the same time. So we typically see this done in a lab or clinical type of setting. So we bring it back, wheel it back into the things that we'll see more commonly in the wellness field, fitness fields, even performance field. And so mindfulness, coming back around to this is a big one. It's a big buzzword. It's major in all aspects of health and wellness. And so what it is, again, is bringing our conscious attention to the present. It's just about being here in the moment, letting go of everything that already happened, not worrying and not thinking about what is happening, just being very aware of every single thing that we can perceive right now in the present. So it's this idea of being receptive to information and curious to information and attention. But then the key two things below are, without going down a rabbit hole of like, hey, I'm hearing this sound outside right now. That's part of mindfulness. But if I were to try and figure out, well, what is it? Oh, it's so annoying. Oh, I don't like it. That's not mindfulness. That's adding judgment. That's adding attachment. That's adding assessment to it. And so it would be, okay, I hear a noise outside right now, and that's it. I just hear it. It's out there. I'm okay. I'm still in here. And so it's being receptive, curious, but without attachment or judgment. And we see mindfulness very much attached to a breathing or breath work type of practice. Breathing and breath work are really, really key in that mindful practice, just so that people are able to use breath as a very simple way of being present. So inhaling, exhaling, it's immediate, it's happening right now. It's also something that you do automatically. But even though it's an involuntary action, we can bring some focus to it. We can bring attention to our breath and focus on the breath without judging or attaching. So it's one of the most simple types of ways to enter into a mindful practice. So that brings us into breathing. What happens when we breathe in a really effective and efficient way? So if you think of the upper body, I'm going to shift this down a little bit. We've got a couple different parts in our thoracic space. So we have the neck and the upper torso, clavicles up here. We have our intercostals, that's everything, rib cage space. And then we have the diaphragm, a little bit lower, sits underneath the rib cage. That's ideally where we want the majority of our breathing mechanics to come from, is from the diaphragm. We do not want much breath to come from up here. So if you think of people breathing really short or really choppy or nervous, anxious breath, we call it clavicular breath. There is a tiny bit of musculature activation in healthy breathing from this space, but it's very, very minimal. And then that middle area, the intercostals, so that's the rib cage general space. There is, again, some ignition of these muscles in our breathing, so but about 20%. We don't want more than that. So it's the rise and the fall of the ribs. But when we focus a lot more or really rely on the intercostal breathing, it causes our sympathetic nervous system to arouse and to activate, which puts us in a higher state of stress, activation. If it's something that's chronic for us and we're just in this high zone of activation, we're not able to drop back into parasympathetic nervous system, complete stress cycles. We're going to spend a lot of time breathing here in the upper body and in the intercostals. That continues a cycle of creating more labored breath, more tension through the muscles, and then less effective and less efficient breath. So we don't want to maintain tension. And then we don't want to be more susceptible to higher emotional disturbances. If we're already like just operating this chronic level of stress, our breathing is shallow, it's not very slow, it's not intentional, we're not using the most efficient or effective musculature in our breathing, that's going to keep us at these high levels. And when something comes in our situation or in our pathway that is more of a disturbing or more of an emotional thing, we're going to react to it instead of respond to it. And that's not good. So what we really want here is diaphragmatic breathing. We want the majority of our breath to be from that space. So I'm gonna get my little pointer. We'll go to a YouTube video in a second. So this is basically a general picture of, we've got our rib cage, we've got intercostals that will end up going between here, but this is the diaphragm. I like to think of it as a jellyfish. Here in the clip, it's described as a parachute. I've had other places think of it described as an umbrella, just because of how it attaches to the ribs. But basically, whoops, how this works, go back. So the top part of the diaphragm, when we inhale, that's activating the diaphragm, that top part pulls down. The lungs are going to open as that top part pulls down, as they inflate. The abdominal organs press down. So as that diaphragm kind of just pushes down, so lungs have room, the abdominal organs go down, and then we're going to feel this natural opening, this expansion of the abdominal space. So think of, that's why we call it belly breath a lot. So when you breathe, your belly isn't actually breathing, it's your diaphragm that's doing all the work, and you're not putting air into your belly, it's the diaphragm, but we're pressing that abdominal cavity out. And then on exhalation, that is going to relax. So I'm going to jump and go watch this video really quick so you can see. Okay, so you got a little gist of it. So we know that on inhalation, the diaphragm goes down, it presses those organs out, and that's where we get that bigger chest belly expansion. And it's important to know that the rib cage still holds that diaphragm in place, because we saw how it's attached to the costals to itself with the central tendon, and then in the back towards the spine. So it's important to remember that pattern. I always just like to think of a jellyfish, smooth and steady as it moves. All right, that's going to be the end for today. Next time that we jump on, we're going to go into a whole slew of breathing practices and examples. So thanks for following along today.